He's got an MSc in prosthodontics and implants and specialized in perio. So we will be honored if Dr. Felipe will present us with his lecture.
Hello, good morning. I'm Felipe Bezerra from Brazil, and I'm very happy to stay here in Iraq. Before here, I had one amazing experience in your country, meet a lot of different people, cities, and I had one amazing experience in my 2 groups in a row handler course with Abdullah. Thank you, everybody. Thank you, IDEX, for this honorable invite. It's a pleasure for me. Thank you, everybody, for coming, and let's go. Please turn off the lights, please. The lights can turn off. Okay, let's go. Now, for beginning, I would like to think that you are not a dentist. You are an engineer. One engineer finishing your university and beginning your career. Okay? like all engineers when finish university with a big dreams to building big buildings, big stadiums, big hydroelectrics. But what do you think? Do you think that one engineer in this moment in your life is prepared to accept one develop like this? Or need to wait one time for accept this? It's the same with us. We are a dentist, and today in Instagram, in social media, in magazines, all the time we see different cases. And sometimes we are a young dentist, and we are not prepared for that. So it's much better wait your time and walk step by step. This is the best thing to do. When one patient arrives in your clinic, one thing that I do is ask for yourself if this patient is one of your family, your mother, your father, one of your son. You will do the same thing? If the answer yes was yes, go, do it. But if the answer was not, don't do it. Today, in social media, I all the time receive this question. Felipe, a problem with composite resin is that the pigment fracture, loosen, wear, and do not have a good longevity. What do you think about this? I think that today we have amazing materials. We have amazing protocols to follow. And we need to stop victimizing us. Because I have no doubt, the materials that we have today in my hands, it's amazing. We need to understand simple things. Because sometimes we only pay attention in complicated points and forget that simple things like adhesion, like other simple things, the most of the times are more important for us, and not only difficult points. We need to understand about composite resin veneer, because composite resin veneer is one technique dentist dependent. Depend us. You that will decide the material. You that will select the technique. So points like this is very, very important for us. We need to understand that points like this, like for polymerization, and a lot of this point. How will be strong, your polish, your brightness, how long this composite will be during the month, everything depends on this effect. We need to understand that brightness is not the same as polishing. For brightness, it's very simple. If you use one bad surface, one polish paste, in the same moment you will find the brightness. But the polish is the point. Your press surface is the most much important for it. So, I'm asking you again. Is it really that composite resin, pigment fracture, lose and wear out and do not have a good longevity, or us that need to master it a little better? What do you think? Think about this point. It's a very important point for me. I think if you turn off the lights, it will be better for images, I think. If it's possible. Thank you. Now I would like that you imagine that we have here one beautiful and very expensive painting. Thank you. But what do you think? This painting, famous and beautiful, is complete, or for being complete, need and think more? Like one frame. But what do you think? Can be one frame like this? Or need be one perfect frame for this amazing painting? And if you find this amazing painting with this amazing frame in this space, what do you think? Is good or is not good?
Not good.
It's not good. Because you need to find one specific space for this specific painting, this specific frame, and now you will find your complete art. It's the same when we think about the smile. Because when one patient arrives in your clinic, you want to change your smile and not only your teeth. And our frame, our painting, when you think in one smile, is our lips, our architecture, our teeth. The teeth alone is not the point. Maybe the teeth are the most important point in one smile. But you need to see every element together. You need to see your facial profile too. And for me, the most important point, and the most of the time we forget this, the psychological profile. Before beginning your case, it's very important you have one good talk with your patient. Because one smile that is perfect for me sometimes is the worst smile for you. And the most of the time we forget this point. And after that you will find one amazing smile. I will show you today two different cases. One simple, to show my philosophy, how I think about my cases, and one different case for finish. When a patient arrives in my clinic, the first thing that I make in all cases is one complete photographic protocol. This point is very, very important for me today, because when you see one smile in pictures, you can see static points and you can plan a lot of better your case. All the time I begin my plan for this kind of photo. The position that our patient rests. And pay attention to this point, because this picture, for me, for planning my smile, is very, very, very important. Because in this picture, we see how our patient show your teeth in rest position.
And this point is very important because the most of the time we are not smiling but talking. And this is the position that you will see your patients and other people. So for me, I like when one man show between 2 to 3 millimeters in this position, and for woman 3 to 4. You can show serious people, you will imagine in this image. So look for the teeth. If you look for the line in the incisal area, you see what? Line like this, okay? And this line is serious. And because this, your teeth is not big. So, in this case, for beginning, I decided to make my crown lengthening. And one point that is very important point is, in all cases, we need planning. We need planning. This is the point. And before beginning all cases, in all my cases, I train with walks up. And you see, it is impossible for you to see all points, the gingiva, the lips, the teeth. You only will increase your teeth because times, yes, you increase. After making my crown lengthening, it was veneer you broke more. So in this case, I prefer make my case, my posterior teeth with ceramic veneers. Now I will show you how I plane in my case,
how I make my cases follow my technique, okay? The patients arrive, we make my walks plan. After my walks plan, you will do our index, our palatal guide, okay? We form silicone. And in my case, I cut my index in this line. This line for me is very, very important point for me. I always cut my index in my incisor vestibular angle, because when I cut my guide, my index in this point, if I see for one lateral view, I can imagine my end volume, and after that I can control all my steps behind this line. So, my first step, I will make my palatal shell. And look for my palatal shell. I will make my palatal shell very, very thin, okay? This point is very important too, because sometimes we make our palatal shell very thickness and we don't have more space for next steps. So, when you make your palatal shell, you need to see this, like one umbrella here, okay? And in this point you need to think, what kind of composite I need for making my palatal shell? I need one composite with opaque characteristics? No. I need one composite with translucent characteristics? Yes. I need one strong composite for this step? Yes or no? Yes. It's very important to use one strong composite for this step, because our composite cannot break. And this point is one very important point for this. I use in this case one composite by name Trans30 by Ivoclar, but you can use any other. After that, I select and I use one composite for make my dentine. And I know that today everybody wants to learn difficult case. But in my real clinic, in my real day, I use the most of the case only 3 kinds of composites. More than 95% for me, if you use one composite with translucent characteristics, one composite with one opaque characteristics for dentine, and one composite for our enamel, for me is more than enough. It's not necessary to complicate your case. And what we need to find, what we need to select in our dentine step, we need one composite with translucent characteristics? No. We need one composite with opaque characteristics? Yes. We need one composite strong for this step? Yes. We need one very strong composite too, for help us. And we need one composite with one good thixotropy. Because the composite that you use need help you make your work. If you don't have this property, when you draw your mamels like this, when you finish drawing your first mamel, if your composite don't have one good thixotropy, your mamel will close and don't will help you. This point is very important for me too. We create our incisal line with one opaque dentine tube, and we will use in this case one composite with translucent characteristics and use between our molars. Between our molars. This kind of comparison you need to see if you want to show a lot your molars or not, because you can change this composite. One composite with high translucent characteristics or low. You don't know about this point. For finish, in my technique, I use one composite for enamel. And in this step, you will find this. I don't want to see one beautiful case in this moment, okay? Because in my technique, I prefer use more enamel that I need, because I don't like building my enamel in different steps, incremental steps. I prefer use only one step, because when you use more than one step, you will find in the end more bubbles in your surface. And for me, the enamel step is very, very important. So I prefer using more than I need. And with my technique for reduction anatomy, we will find our true volume in the end. In this case, I use BL1 by Stellite Omega by Tokuyama, one amazing composite. And for enamel, you need to think. This point is very important too. What do you need for this step? You need one composite strong for this step? Yes, but it is not the most important point. You need one composite with a good shine property? Yes, this is the point. Because sometimes you see in your case your color change. But sometimes you don't select the true composite for this step. Okay? You need to select one composite with one amazing property for don't change your color. And Stellite by Tokuyama is one of the best that we can use. After that, we will use my technique for find our anatomy. And for it, I use burrs, fine drills, discs, different discs, blades, strips, and one pencil for guide you in your work. And with this, you will draw your lines for guide you in your anatomic. For beginning, we will create our primary anatomic. And for our primary anatomic, we will take our transitions line, and with our transitions line, we will find our flat area and shoulder area. This point is very, very important point too, because if you want to find in the end one natural teeth, these different areas is very, very important for you, because our shoulder area is one dark area, and it will show more natural your smile, and is one important area for your foods too, because this is one escape area for your foods too. We will see our incisor spaces, incisor abutments, our inclinations, our apes, and you finish now your primary anatomic. And for me, our primary anatomic is the most important part in our teeth. If you make your primary anatomic like you need, you already have one beautiful and natural teeth. But if you want, you can make a little bit more. You can make your secondary anatomic. And for making your secondary anatomic, we have grooves, vertical grooves, and horizontal grooves. But for do this, you need be one training hands. Because if you make more than you need in this point, your beautiful case will be lost. And our tertiary anatomic. And for me, in natural teeth, we find these characteristics. But in composite resin veneer, for me, is not necessary. Because it's impossible to see these characteristics in one smile. Okay? So I don't do this in my case. But in natural teeth, you can find micro textures, horizontal, vertical, like one digital impression. And after this point, before our shine, like I told you, it's very important to use things like these cups. In this case, I use Flex Cup Blue by Cosmident, Flex Cup Pink by Cosmident, Silicon Carbide for Polish Tool, Spiral for Auto Polish by Jota, one paste for it, one shiny paste for it, and after you use everything together like you need, you find your end result. Now let's see how our case evolution. Look for this image. What do you see? This super upper image or this image is more young for you. What do you think? This mouth, exactly. Because you need to show our teeth position. Look, when you think not only in teeth, but in all elements, you will find one best smile too, more equilibrated smile. And when you see for this and imagine, and what do you think? This imagine or this imagine is more happy. What do you think? A lot of, because now you have your smile line. And this point for me is very, very, very important point. Because the smile is the same, but the feeling is different when you find your true smile line. Now we have our overbite and our overjet too. And now we have our guides. And our guides is very, very important for your longevity. For finishing my case in Brazil, I know that it's very different here, but in Brazil, take our picture with our patients for register this moment and send these images for our patients, because this point will be one very important point for this patient remember us.
Eu gostei muito. Ele mostra, além de toda a parte estética, o que pode influenciar na vida da gente como todo, né? Eu gostei muito. Desde quando eu entrei no consultório, do atendimento das recepcionistas, quando eu cheguei até ele, eu me senti muito confortável, uma conversa muito boa, muita vontade. Ele passa confiança, ele mostra, além de toda a parte estética, o que pode influenciar na vida da gente como um todo, né? Meu primeiro contato com o Felipe foi através do meu esposo, que já tinha feito um procedimento com ele, e aí indicou e eu fui fazer uma consulta. Gostei muito, né, da confiança que ele passa e toda a conduta dele, e que me fez despertar essa vontade de ter um novo sorriso. Feliz demais. Uma mulher, um novo sorriso, a gente fica mais com vontade de sorrir realmente. A gente às vezes acha que não é tão importante, né? Mas dá uma diferença enorme mesmo, muda o nosso sorriso e muda a nossa atitude também, né? O que é bom. Continue fazendo com amor que você faz, porque você, sem perceber, com toda essa dedicação, esse empenho, esse perfeccionismo, você deixa-nos segura, muito bem servida, muito bem atendida, e até hoje a gente tem uma relação de amizade e outra combinada. Então, eu amei e indico o meu dentista.
Okay, let's go. Now, I have one different case for showing you. This patient arrived in my clinic here 7 years ago. My name is Rodrigo. And when Rodrigo arrived in my clinic, Rodrigo arrived with one big problem. This position is a video position. Rodrigo can't close more your mouth. Okay, this is your end position. And after one big talk with Rodrigo, Rodrigo told me that in this moment, Rodrigo made 10 years with orthodontic treatment. And I see how 10 years, yes doctor, 10 years. And this is my end position. Rodrigo had one accident too and lost your 2 frontal teeth. And in this case, after this, I tell to Rodrigo, I need some size your exams like computed tomography for see your bone at this moment. And look, when this exam arrived in my clinic, we had this. What do you see here? Rodrigo lost your bone in all your mouth. Don't have more bone. Don't have the frontal bone. Don't have the sinus bone. Don't have bone more. Look, different views. And what do you see? With this condition, we can continue with orthodontic treatment or we need to stop. We need to stop. We need to change our plan. And at this moment, I need to think a lot what I need to do for help Rodrigo now. And have one sentence that I like a lot. The sentence is, learn the rules like a professional so you can break them like an artist. By Pablo Picasso. And in this case, it's exactly this. Because if you follow the rules, it's impossible to finish this case and help Rodrigo. So after think a lot, I decided make one different kind of treatment. I decided make reduction of OVD with occlusion adjustments. Let me show you. I divide Rodrigo mouth in 4 quadrants, and without anesthetic, I make my adjustment occlusion, quadrant per quadrant. A little bit here, after that a little bit here, a little bit here, a little bit here. In 3 different sessions,
without anesthesia. Because my intention is close more your mouth and rotation your mandible. After these 3 sessions, I find this new position. It's not amazing, but it's much, much better. And look for the lips. After 1 month, the lips change your formats. Because now we find one best position for your mandible and for everything. In this case, now I will see the spaces that we have, and we see that we need one incisive center with 30 millimeters for close your mouth. When you see the spaces that you have for it, we find this number. About proportion tips, you know that one tip with 30 millimeters taller and only with 80 millimeters for your white is not proportional, okay? So, in my clinic, for finding this best position, we use the best proportion that we can, and we know that our incisional center need to be short. So, in my hands-on course, I tell you all my technique for make case like this, okay? Here need to be fast, because we don't have time for it. But we decide after that, make one, use one drill for make this disgust here in laterals and increase our weight for our central. And now we have one central with 9 millimeters and one incisive lateral with say 6.5. We went for our center surgeon for making our crown lengthening. But in this case, in our crown lengthening, we can't remove bone because this patient don't have bone for it. So we make our plastic gun and wait where this gun, this gingiva will stop. In the same surgeon, we make our 2 implants in this central area. Our crown lengthening and our 2 implants. And at this moment, I didn't have in my clinic one CAD-CAM. And after one good talk with Rodrigo, I talked with Rodrigo, your case is one very difficult case for me, and I need to find your best position for you, the best proportion for your teeth. So, I propose for Rodrigo make your case with composite veneers, composite resin veneers. And if one day, after we find your best position, is necessary change this, is not a problem, because now we already have one good position, and if during these years is necessary make adjustments, composite is much better and much easier for it. So we decided made in this case with composite resin veneer for vestibular area and for occlusal area too. In the same session,
using all principles until more. And we find this. And for finish, was necessary to use one prosthesis with pink ceramic tube. Because in this case, we already know that it's impossible increase the bone like we want. So we forget this and decide be more fast for these patients. Plain, in this case, with wax. Try find this characteristic. And after finish, we find this. In intro view, you see the lines, for sure, because this is not perfect for this. But that we have this. But we plane these lines, for in your smile, you can find these lines. And can be mimicry, use different material. Composite, resin veneers, ceramic, gingival prosthesis, and natural tips. And we finish this case like this. For remember, step by step. And how we change your smile. It's not perfect, but this is one difficult case for us. And this is Rodrigo before and after treatment. Look for your eyes. Is happy? A little bit. Our end pictures. And for finish, let me show you the Rodrigo movie. It's very interesting.
A gente vai fazer isso para uma anamnese, tá? Só para você entender um pouco da logística. A gente vai fazer uma anamnese, eu vou te avaliar, tá? Seu caso está bem complexo. Não precisar só necessitar exames complementares. O que são isso? São raio-x, tomografias, tá? E pouco que eu quero que a sua parte óssea, como é que tá? Por que você está com essa mão aberta até hoje, depois de tanto tempo de tratamento oncológico, tá? Eu te garanto uma coisa. Se der para fazer alguma coisa em sua conta, a gente vai fazer, tá? Eu te garanto, eu vou deixar mais uma tela do que isso. E de forma muito mais rápida do que você tem feito na oncologia. Quero ver você baixar, já tô ansioso. E aí, meu brother? Vou fazer, de verdade. O desafio pra mim é muito grande.
Eu, sinceramente, eu não esperava estar pela honestidade dele, que é uma pessoa muito sincera. Ele não é um cara que trabalha. O dinheiro da ele é consequência do trabalho que ele gosta. Quando lá ele é mulher. Modelo praticamente.
That's it. Thank you for your time. I hope you are enjoying this moment. Apologize because my English is not the best, but I try to give my best here. And this technique I showed last week in 2 groups in a row in my hands-on course with Abdullah, and I already was invited for come back here in Iraq next year with this course. So if you want to learn this technique with me, please call with Abdullah with Aladdin Dental Story, and it will be a big pleasure for me. Now Iraq is my second home. Everybody here is very friendly all the time with me, with my wife Jessica, and I'm feeling like my second home here. Thank you for your time.
Thank you very much. very informative lecture, very interesting. I've got one question. Don't you see that when you lengthen the incisors, you're going to have some kind of mismatch between the length and the width? I'm talking about the first case. Yes. No, I mean that when you lengthen the tooth or the crown, don't you see that the tooth is going to be, the length is proportionate with the width? We have one count to do for 5 dispersions. Okay? For 5 dispersions. When one patient arrives at my clinic, the first thing I see how great
عليكم السلام. بس باكيجات